Welcome back from the break. This is still the Pulse on the Joy News channel. Now, there's a major advocacy by the Stop TB Partnership to put tuberculosis and its adverse impact on citizens' health and the country on the national agenda. The organization is seeking to revitalize the TB caucus of Parliament to push the move. At a meeting Friday with the parliamentary group, it secured the assurances of MPs to deepen the advocacy in the national interest. Tuberculosis remains a pressing global health concern affecting millions of people around the world. In Ghana, the escalating number of TB cases poses a significant challenge to the country's healthcare system and its progress towards achieving the Sustainable Development Goal target of ending the TB epidemic by 2030. Parliamentary Affairs correspondent Kweku Asante joins us with details. Kweku, first, how big is tuberculosis on the agenda of Parliament, and does this new initiative make any change?
Well, I should say that this new initiative appears to be the one pushing members of Parliament to do more. In fact, today in Parliament, almost all who mattered were at this event, starting from the second Deputy Speaker of Parliament, who is the only speaker who is around town. Joseph Osei is not around. The Speaker himself, Alban Bagbet, is not around. The leadership is not also around. You know that the minority boycotted. So the higher echelons of Parliament who are actually around at the moment were all at this conference. I mean, giving you a sense of how much important this partnership from this TB partnership and this network means to the MPs. In fact, if you look at the Health Committee, the chairman of the Health Committee, Dr. Nana Yufie himself was there. The MP for Nabdam, Dr. Ket Nawani, was also there. So hitherto, I've not heard much of a conversation around whether or not TB was such a big thing for parliamentarians. But today, MPs are now commenting and they are saying that this is something really that they think and deepen the process in terms of putting TB back on the higher pedestal of the country.
Interesting. And so from the way the parliamentarians received this, do you see any sort of, commitment, higher commitment really to this cause?
Well, that's actually the biggest takeaway from today. In fact, in time past when conversations about TB has been had on the floor, it was almost always brushed off as though it was not really important. But today, MPs are committing that whenever health ministry budget comes, for instance, they are going to make sure that there is something big for TB. It means that they are going to be speaking about it. They are going to make statements about it on the floor. They are going to demand that the health ministry, the Ghana Health Service, which was also there, I saw the health of public promotion of the Ghana Health Service was also there. So it's also the bigger commitment that is coming in now. But now MPs are assuring, when the Deputy Speaker made his speech, he actually acknowledged how big of a concern TB is in the country and how big of an issue that the citizens must take it. And they are starting this from Parliament, committing to ensure that there is enough budgetary allocation to the Health Ministry, to the Ghana Health Service, and all other allied services. So clearly, this partnership coming from the TB partnership is such an incredible feat for parliamentarians now, and it is something that they're going to hop on and ensure that what is necessary is done.
Did they give any reasons why probably in the past it hadn't been that huge on the agenda as members of Parliament?
Well, no reasons officially were given, but you realize that for politicians, they usually move with the wind. So if something is big, you can suddenly see that MPs will hop on it. Okay. TB isn't a thing that has come up so big on the floor. In fact, in the last year, it hasn't even come up on the floor at all. No questions have been filed, usually on such important matters. That is why it's so important what this TB partnership is doing to bring this agenda to the doorsteps of Parliament. There's a caucus for parliamentarians to hop on this. There's a TB caucus in Parliament. What the partnership with this group is now seeking to do is to revitalize that caucus to ensure that it's big on the agenda. And people concede that they should have done more, they should have done better, but there's no better time to do it than now, and it's always better late than never.
All right, grateful to you, Kweku Asante, joining us from Parliament today. Thankfully, we've been joined in the studio by David Kwesi Afre. He is the chairman of the Stop TB Partnership of Ghana, and he's here for us to have a chat on this. Grateful to you for joining us now. The campaign against TB, just like HIV and AIDS, has been a long one. Question is, why is it still a challenge?
Yeah, thank you so much, Kweku. TB is still a challenge because a lot more people die of TB in Ghana. that you can imagine. It is clear, according to our own prevalence surveys, when you are taking every 100,000 persons of Ghana, you have a minimum of 87 active TB cases.
100,000.
When you take every 100,000 population in Ghana,
We have 87.
you have 87 active TB cases among them. Now, so what it means is that we are supposed to be finding about 44,000 TB cases annually. As we speak, we are finding around 16,000 annually. And so you have many more people dying every day of TB. The statistics are very scary.
So we are finding or funding them.
We are finding them.
Okay. So
Now,
we have to
so
find
what it means is that
44,000.
we're supposed to find 44,000 TB cases annually.
Okay.
We are not able to find a 44. We are finding only 16,000. We are supposed to find 44,000.
Do we know the reason behind why we cannot find all the 44,000?
Yes, it is because of logistical constraints. It's a business of funding that is not there. Before you find one TB case, you need to spend a certain amount of cedis or dollars to be able to reach out to find one TB case in a community and put on treatment. Now, resources to be able to put people, community workers like civil society, to go to hard to reach communities and everywhere they can reach. Resources to drive the agenda on the media, involving you, the media houses. Ensuring that nurses, in the health workers in the Ghana Health Service at the district level, at the CHIPS compound level, at the NGO level. I mean, it's not there. You have, as we speak, for example, we have only 97 NGOs that are working across the country with meager resources, finding the TB cases that they can find to support the government. Okay. If we are talking about 270 districts, for example, or constituencies, for example, and you have only 90 that you are reaching. In fact, when you come to the tools that we use to screen TB, that is in the laboratory, we are talking about gene expert machines. And gene expert machine is covering just about 1/3 of the country. So what it means is that we are not, gene expert machine, it's a machine that is in a laboratory.
Yes.
So if we take sputum of a presumed TB case to the lab, we are supposed to use that machine to screen in a lab to determine whether, and we don't have up to half of the country covered. Okay. In other words, this is the reason why with the Stop TB Partnership Ghana, for example, you have NGOs transporting sputum from one district to the other, where you can find the machine, so that you cut down the catastrophic cost it has to take to get one person to know that they are positive. So they go to the communities to go and screen, and then when they presume that you are TB positive, then they take the specimen, which is principally the sputum. This sputum must be tested in a laboratory for you to be confirmed positive or negative. Okay. Now, the machine that detects this, I'm telling you, we don't even have enough in the country.
Are these not the machines that during the height of COVID, we had to convert some of them to be doing the COVID testing?
Exactly.
Those are the machines?
Those are the machines. So what happened is that they were using a different machine for COVID, but along the line, then we have to rework things to see how we use the gene expert machines to also test. And this is why COVID tests were traveling from one region to Accra before they are tested in Gucci until the gene. So what we need is more of the gene experts in the country. If we can have more gene experts in the country, have more money coming in from government, as we speak, we actually have only, for the next 3 years, we have a budget of $80 million from our donors, that is Global Fund. Okay. The government of Ghana's commitment is not there. So what we need now, the TB program needs a budget of about $18 million annually. Okay. So if you have only 18 million for the next 3 years from your donors, if you divide 18 million by 3, do we have up to 9 million? No.
You need 18
we
million.
We need 18 annually.
Year.
Yes.
But your partners are making 18 million for you for 3 years.
So we need government support. We need the president of Ghana to come in. Just as he allocated resources to COVID when COVID came, you need to allocate resources too. Because Ghanaians are dying every day of TB. You have more than 30 people dying every day. The statistics are clear. And so we want to call on the president of Ghana. We want to call on the Minister of Finance we want to call on Parliament. And that is why we were in Parliament to do this.
So on that note, are you confident that the MPs are willing to now champion the cause of TB and to make sure that you are getting the right funding to deal with the issue?
Oh, yes, their commitment is clear. I mean, it has to take us a lot of mobilization, a lot of education, a lot of sensitization to get to talk with the committee of, select committee on health to understand us, and then now are ready. And so as I speak to you, the chairman of the health committee, Honorable Ayu, himself is Afriye is the chairman of the TB caucus in Parliament, and the others are supporting him to make sure that they drive resource mobilization for TB in Ghana. They are aware of the gaps, and the commitment is clear. The deputy speaker, I was with him, my team was with him in the office today for about an hour discussing the processes we have to go through to make sure that we have increased budget in the next budget 2024 for TB. And it is resounding, and it is becoming more refreshing that the energy is catching up with Parliament. If the leadership of Parliament today, represented by Honorable Isiama, the only speaker around the country in the time, ready to make sure that he drives the business. In fact, he promised categorically to take it to the business of Parliament to ensure that resources are allocated to TB in the next budget.
Okay, interesting. Now, we understand that this event is a build-up to the UN high-level meeting in September.
Yes.
What is that about, and why is it crucial for the campaign against TB?
So this is what happens. For example, in 2018, we had the president of Ghana and all other presidents around the nation going to the United Nations general meeting on TB, and they signed on to certain declarations which were supposed to be targets that Ghana has to achieve. For example, we came back from New York, we were not able to achieve those targets. We are around 60-65% of achieving those targets. Now, we have an upcoming UN high-level meeting again on TB in September 2023, specifically. And Ghana is expected to participate, of course. So now, revitalizing the TB caucus in Parliament is a tool to make sure that, one, the parliamentarians are able to work with the missions, Ghana's missions to the United Nations, and to ensure that Ghana participates in building the declarations that are supposed to be meant for nations to sign. So then, after the commitment, after this declaration is designed, we need to get the MPs as a tool and to get all that matter in the Office of the President, Office of Ghana Health Services, Office of the National TB Program, and then among we, the civil society, we must form part of that delegation to go to the United Nations meeting on TB, and then we all form part of the declaration. When we are back, we want Parliament again, the TB caucus in Parliament again, to be a central tool for the demand of accountability on the President and all of us in making sure that we translate those declarations that we are going to sign onto in September this year into commitment for the country to make sure step by step we become accountable in resource mobilization, we become accountable in making sure that the people are screened, the people are treated, we are making sure that there are availability of all the logistics that are needed in this cascade of TB business in order that we are able to end TB particularly by 2030.
No, but 7 years we have 7 years to go. You just said that we are just doing around 16,000 out of 44,000.
Yes.
And we want to end it by 2030.
Yes.
That's unrealistic. But in your estimation, with what I've even just said, what do you make of our commitment towards the UN commitment?
So this is, our commitment are not good enough because we are not bringing, the president who has gone to sign onto it has committed to coming down to put TB on his own political agenda. That he has not been able to do. Okay? So then the commitment of the presidents of Parliament and the Minister for Health and the Minister of Finance are not enough. But that is why the Stop TB Partnership, we are thanking our mother organization, the Stop TB Partnership Geneva. Thank you, Luchika. Thank you, Chief Austin. They are the global guys trying to bring down resources so that we can hold the leadership accountable by putting TB on the high political agenda. So we know that their commitment hasn't been good, but that also means that we have not held them accountable. Okay? So our role as civil society now is to make sure that we are holding them accountable. And so long as we can keep holding them accountable and working with the structures that are there, we should be able to end TB if we have the needed resources. COVID came. Like joke, the president announced a $100 million facility. Suddenly, in a year or two down, we can talk about the impact of TB, COVID down. If the president can allocate even $10 million a year
for
TB to support the global fund. Look, let me give you this. TB it's woefully underfunded. Global Fund helps Ghana with 3 diseases: TB, HIV, and malaria. For malaria, we are giving, for example, for the next 3 years, starting 2024, we are giving $120 million. Okay? You can divide that into 3 and know the annual budget. And then HIV is receiving
$40 million.
You understand? Every year. And HIV is $95 million. And TB is $18 million. So if TB is $18 million, how do we end TB? Now, TB actually needs a minimum of $18 million a year. And we are going to be getting from our donors $18 million for the next 3 years. So we need the president to come in. We need the president to come in. The donors have tried their best. They are bringing something. Now, TB is killing. Look, it's serious. Somebody will need to talk more about this. We call on all of you, the media, to get interested. Call on the National TB Control Program. We'll bring them. Let's discuss it. The number of people who die every year out of TB. In fact, when we even detect people and they are on treatment, those that die because they are not detected early. Most of this is because we don't have the resources to go looking for them. You see, when COVID came, the president allocated money for case tracing.
Tracing.
You understand?
Contact tracing.
Contact tracing. So where is the money for contact tracing for TB?
For TB.
If I am TB tomorrow, there should be resources allocated in one form or the other.
But if we know we don't have the funds, that, it's not coming for us to do that, then we have to look at how we can prevent people from getting it, isn't it? How can someone prevent him or herself from contracting TB?
You see, treatment is prevention. If you have person living with TB with you, you don't have a choice.
Okay.
So the biggest way of prevention is treatment. So those who are already existing, this is why we're talking about vaccine for COVID, so that you limit the number of people who are carrying the disease. And when people become immune and we have herd immunity, where majority of the people are vaccinated, they're fine. Now, until we have the vaccine for TB, we are not there. We already have that estimate of 44,000 people who are in Ghana living with TB. Annually, if we work hard, we should be able to find, and we are not finding them. So what it means is very simple. We have to, those who are already living with TB, we must invest to find them. If we can find them and cure them off the system, nobody will get infested again.
So in your estimation, what does the Ghana Health Service need in the short term to help the tuberculosis control unit to mitigate the spread?
It's resources. We need urgent resources. You see, when the program has money now, one, they will increase the number of diagnostics facilities in the country. Now, this diagnosis machine called GeneXpert also need what we call the cartridges to be able to operate it. Now, we have always had shortages of cartridges. The reason we have shortage of cartridges is because of lack of resources. So our donors say that we are going to give you this amount of money for TB. Now, you are working, and the money they've given to you, you have used it to procure certain logistics, including cartridges, put-on containers, drugs, and all of that. Now, before you realize, the shortages have come because government has not had money to buy more to cover the country. And so there is always shortages of everything. So we have shortages of GeneXpert, we have shortages of X-ray machines, we have shortages of cartridges, you have shortages of drugs, shortages of put-on containers, so human resources not everywhere.
Oh, wow. That's a serious issue then.
Good. So we need the president to bring his voice onto the table for TB. And it is Ghanaians who are dying. In the last 2 years, the president has invested $100 million for COVID. And today, he can declare COVID not a threat to Ghana. if we can bring the same attention to TB, the Ghana Health Service will do their work, just as they did it for COVID.
Okay.
The National TB program is available. I salute Dr. Yao Edusipoku. I salute the Director of Public Health, Dr. Franklin Esiedu-Bequin. They are doing a wonderful job. What they need is resources. Okay. Call on the Director General of the Ghana Health Service, he will tell you what he needs is resources to make sure that there are simple logistics that have to be driven. Civil society is ready. We have NGOs in every district, but we don't have all of them actively working because we don't have the resources to give them.
The funds.
We don't have the funds. And what can they do? There are times that even if you have a small fund and you go to the community to collect sputum, and you come to the laboratory, there is shortage of
cartridges.
Yes.
The resource.
Work done is zero. So if we are going to drive TB to an end by 2030, we need to drive resources.
But realistically,
and
can we do it?
Yes, we can, as long as. Did you believe that COVID could go? Is it not unprecedented, the amount of investment that has been done into COVID?
Okay.
We need to invest in vaccine for TB. Okay? If we can invest in vaccine for TB, those who are already on treatment, and we clear them off, 7 years is too much. All we need is money.
Okay. Interesting. Okay.
All we need is money.
How many people die of TB every day? Do we know? Do you know that number?
The last time we checked, we had 30 people dying every year.
30
Ghanaians every day. Yes.
Of TB.
Yeah, globally it's a huge figure. We're talking about $1.6 million.
Wow. Something must change.
Yes.
Something has to.
In fact, TB is now killing more than malaria and HIV.
Wow. Yeah, because if 30 people are dying, that's serious.
Oh, yes.
And I hope that
that is Ghanaian figure.
Okay, I understand where you're going.
Yes.
You mean that these are the ones that are recorded?
Yes.
The ones that are not recorded?
You can imagine that.
Okay, interesting.
You can imagine.
We wish you all the best in this fight, and we hope that indeed it becomes a topical issue. Like you've stated, we would also do our part to ensure that we all drive this, because it's scary. The numbers you're giving are very, very scary. 30 people dying each day.
Oh, yes.
It's a scary number. Thank you for coming, sir.
God bless you.